And here's another coronavirus headline. The federal government is classifying the deaths of patients infected with coronavirus as COVID-19 deaths, regardless of any underlying health issues that might have contributed to the loss of someone's life. Here's Dr. Birx during the White House task force briefing yesterday.
I think in this country, we've taken a very liberal approach to mortality. There are other countries that if you had a pre-existing condition, and let's say the virus caused you to go to the ICU and then have a heart or kidney problem, some countries are recording that as a heart issue or a kidney issue and not a COVID-19 death. Right now, we're still recording it. If someone dies with COVID-19, we are counting that as a COVID-19 death.
Joining us to discuss is Seth Denson. He's a healthcare analyst and author of The Cure, a blueprint for solving America's healthcare crisis. Seth, Dr. Birx admitted this was kind of a looser approach in counting COVID-related deaths, despite other nations not doing that. Do you think this number is impacted now by the true number of Americans dying from coronavirus?
Well, I think that when we start to try to analyze the fact of, was coronavirus part of the problem or the entirety of the problem, I think we're getting far away from what the reality is, and these Americans are passing away. And yes, we absolutely should track the idea that those with underlying health conditions may be more susceptible, but it doesn't change the fact that the coronavirus is impacting the death rate of Americans. Underlying conditions are not.
Right. Okay. I want to talk about this. Do you believe that social distancing measures and stay-at-home orders around the country are working?
I do. I think they're absolutely working. And matter of fact, if you look at just even, and I know New York is a hotbed, but look at maybe San Francisco and some of these other areas that started social distancing earlier on, it is bending the curve. Now, here's the challenge, and I think a lot of people don't understand this about social distancing. Social distancing was mostly to make sure that our healthcare system wasn't overly taxed, that we couldn't handle the influx, but it does spread out the time by which the virus could be in play. So again, it is working. The challenge that we have now is at what point do we need to try to find a way to, let's say, walk and chew gum at the same time and reopen our economy and make sure that it's in line with controlling the virus?
Right. We are continuing to see, unfortunately, more cases, more deaths as well. During the White House task force briefing yesterday, President Trump highlighted the extent of coronavirus testing as well throughout the country.
America continues to perform more tests than any other nation in the world, and I think that's probably why we have more cases. We've performed 1.87 million tests to date, so that's 1,870,000 tests. Think of that, 1,870,000 tests to date. And now we're performing them at a level that nobody's ever seen before.
Of course, more access to these tests means we could potentially diagnose more people who might have coronavirus. What should we be making of these numbers as well?
Well, absolutely. I think that if we were able to test every American today for coronavirus, we would see staggering numbers at the number of people that have this. And you can take that in one of two ways. Obviously, it is concerning when more people have it, but at the same time, it will show, the numbers, I believe, would show that more people are either asymptomatic or having limited impact from the coronavirus. Either way, more testing is imperative because if you know you have it, you'll take more precautions. You'll stay home. You'll do what you need to do. And so the idea that we need to continue to ramp up testing is absolutely an essential one, and we must get that done.
Right. I also think, again, going back to Dr. Birx's point, the idea of not really taking into account these underlying conditions, it might not be projecting the accurate number of specifically COVID-related deaths. Is there, a response you'd have to that?
Yeah, I mean, no question that the more that we know about the disease, the virus, the more we know how it impacts certain conditions, the more we can ascertain whether or not it was the coronavirus that is causing these deaths or an underlying condition. But either way, I think that there is a reality that in some cases it could be a combination of both.
Right. I think you'd have to consider that as well. Seth, your role as a healthcare analyst, we're seeing these hospitals dealing with these patients every single day. Healthcare workers are putting in so many hours. They're on the front lines right now. What's your message to them who are really sacrificing so much to help, people who are dealing with coronavirus?
Yeah, thank you. That is the biggest message we can all give. Our thoughts and our prayers need to be, and our gratitude need to be going out to these people who are every day putting their lives in danger to take care of others. It is not just a job, it's a calling, and these people are answering that call.
Yeah, and we appreciate them every single day. That's Seth Denson, healthcare analyst and author of The Cure, a blueprint for solving America's healthcare crisis. Seth, thanks for joining us.